My name is Eden Endres, and this is my respiratory assessment video. This is a full 360 of the room. I do have my student guide to reference, but there are no computers or TVs turned on. Hello, my name is Eden Endres. I'll be your student nurse practitioner today. Can you go ahead and tell me your name and date of birth?
Patrick, 4/28/89.
Very good. Today we're just going to be doing a full respiratory assessment. Do you have any questions before we get started?
No.
Okay. So first I am observing the patient's rate, rhythm, and depth of their respirations. So I'm going to count for 15 seconds. I have a clock over here. Okay, so respirations are 12 a minute, which is normal. I'm just looking at worker breathing, any abnormal respiratory patterns, but rhythm is normal, and I'm also looking for any retractions or accessory muscle use. There's no tracheal tugging, there's no use of intercostal, subcostal retractions, and then I'm just going to assess the chest wall for any deformities. So I'm looking for like masses, any asymmetry. I'm going to look in the front and the back, and nothing's sticking out. Both sides are equal bilaterally. And then what I'm going to do is compare the anterior with the lateral view. So normally the anterior diameter is wider than the lateral view, which is the case here. There's no barrel chesting or anything of that nature. And then I'm going to inspect the patient's hands. I'm just looking at your hands here, looking for any clubbing of the fingers or like cyanosis, and then I'm also looking around their mouth to look for any blue color, but lips are pink and there's no circumoral cyanosis. And then I'm looking at his trachea, making sure it's not intubated to either side. It is midline, which is normal, and then without my stethoscope, I'm listening to see if I can hear any audible stridor or wheezing, which I do not hear. For the next portion of the exam, I'm going to test chest expansion. So I'm going to place my hands here, and I'm looking at my thumbs. I'm going to have you take a deep breath, and then exhale. Very good. And my thumbs are like equal on both sides. And then I'm going to have you do the same thing again. Take a deep breath. Very good. And my thumbs again were equal on both sides, which is a testing chest wall excursion. And then I'm going to have you stand up real quick. And I am going to check for tactile firmness. So can you say 99 for me?
99.
Every time I move my hand, say 99.
99. 99. 99.
Okay, and then I'm going to have you turn around. We'll do the same thing. Go ahead.
99. 99. 99. 99.
Okay, very good. You can take a seat. And then, next I'm going to do some percussion to your chest. So first we'll start in the front. And you don't have to do or say anything. I'm just going to be using my hands to tap and pop a ear. And I'm listening for resonant sounds or dullness. And then I'm going to have you stand up and turn around. I'll have you cross your hands, across your arms, and just rest your arms on your shoulder. all done with that, thank you. And I was hearing resonant sounds that were equal on both sides throughout, which is good, that's normal, that's what we want. For this next part, I'm gonna listen to your breath sounds. So I'll have you take deep breaths in and out of your mouth. Okay, you're just, actually you can lie back for me.
All the way down.
Yeah, and I'm gonna listen here in front. So just every time I move my stethoscope, just take a deep breath in and out of your mouth. Very good. I'm gonna have you stay laying down, and for this next part of the exam, every time I move my stethoscope, we're testing for echophony. You're just gonna go ahead and say E, E, E. So one E with every movement of my stethoscope.
E, 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 E.
Very good. And I could hear E the whole time. There was no A sounds, and they did fade a little bit as we got lower. For this next part, I'm just gonna have you say 99, and I'm gonna listen again. You just say 99 every time I move.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, very good. And the whole time, I'm not hearing any like distinct 99, which is what I want. If I do hear a distinct 99, it would be positive for the bronchophony. And then this last part is the whispered pectorally. So I'm just gonna have you whisper 1, 2, 3 every time I move my stethoscope.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Very good. You can go ahead and sit up. So it did entirely fade in the lower lobes for that whisper. So this time, we're gonna do the same thing on the back. I'm just gonna have you stand up, cross your arms over your shoulders for me. First, I'll have you take deep breaths with every movement, and then we'll go through those special tests again. Okay, go ahead and we'll start with the E.
E, 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 E.
Okay, again, normal. I wasn't hearing any A sounds. I was just hearing E the whole time. And then I'm gonna go ahead and have you say 99 with every movement.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Very good. And that, I couldn't hear any distinct 99s when he was saying it, and it did kind of even fade out a little bit as I got closer to the lower lobes. And then the whispered so, just another 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, very good. We're all done. All right, and that concludes our respiratory exam for the day.